Cytogenetics studies diseases that are caused by alteration of chromosomes. Chromosome abnormalities are the leading known cause of mental retardation. They are also the leading cause of pregnancy loss. Today, we will cover 4 topics. First, we will look at human chromosomes. Here are human chromosomes. From chromosome 1 to chromosome 22. In general, the size decreases. Chromosome 1 is the largest chromosome. Chromosome 21, with 48 million base pairs, is the smallest chromosome. Chromosome 22, with 49 million base pairs, is the second smallest chromosome. The Y chromosome contains 59 million base pairs and comes the third. Each chromosome has a short arm, or P arm, and a long arm, or Q arm. When the centromere is located in the middle, the chromosome is called metacentric chromosome. When the centromere is close to one end, the chromosome is called acrocentric chromosome. 6 notable acrocentric chromosomes are chromosomes 13, 14, 15, 21, 22, and Y. Karyotype is an imaged metaphase spread in which chromosomes are arranged in decreasing length. To obtain a karyotype from a cell, the first step is to arrest mitosis. A standard procedure to arrest mitosis in dividing cells is to use colchicine. To stain chromosome, a dye called Giemsa is used. The staining causes chromosomes to have alternate light and dark bands, and this pattern is called G-banding. Fluorescence in situ hybridization or FISH use a fluorescence-labeled DNA probe. The probe is then hybridized with patient's chromosome, which can be observed under a fluorescence microscope. For example, a probe that is specific for chromosome 21 will hybridize in 3 spots in the cells of trisomy 21 patient. This will provide a diagnosis of Down syndrome. Spectral karyotyping involves the use of 5 different fluorescence probes that will hybridize differently to different sets of chromosomes. In combination with special cameras and imaging processing softwares, this technique produces a karyotype in which every chromosome is painted a different color, as shown here. Here is an international system of cytogenetic nomenclature. For example, DEL represents deletion, DUP represents duplication, INS stands for insertion, INV stands for inversion, R for ring chromosome, T for translocation. The most common number of chromosomes in human is 46. A normal individual is a disomy. It can be described as 46XY for a male and 46XX for a female. Each arm is divided into regions starting from the centromere. For example, here is the X chromosome, and here is centromere, and this is P arm, and this is Q arm. Each arm is divided into regions. Each region is further divided into bands. As a result, XP21.2 represents a position on the P arm, region 21, and second band. Between 15% and 20% of all recognized pregnancies ends in spontaneous miscarriage. About 50% of all spontaneous miscarriages have a chromosome abnormality. These results indicate that chromosome abnormalities account for the loss of a very high proportion of all human conceptions. Today, around 20,000 chromosome abnormalities have been registered on laboratory databases. Chromosome abnormalities can be divided into two groups: numerical abnormality and structural abnormality. A numerical abnormality refers to change in number of chromosomes. It includes aneuploidy, polyploidy, and mosaicism. A structural abnormality refers to change in size and shape of chromosome. It includes deletion, inversion, and translocation. Now, let's move to part 2. We will look at numerical chromosome abnormalities. Numerical chromosome abnormalities can be divided into three subgroups. One is aneuploidy. Second one is polyploidy. And third one is mosaicism. Aneuploidy refers to a situation in which chromosome set differs from wild type by only one or a small number of chromosomes. Examples include autosomal trisomy, trisomy 21, sex chromosome aneuploidy, such as monosomy 45X. It is also known as Turner syndrome. Polyploidy refers to a situation in which a cell has entire extra sets of chromosomes. People with triploidy have 3 sets of chromosomes. One particular case of triploidy is height-deformed mole, which occurs when 2 sperms fertilize an egg. Tetraploidy refers to a situation in which a cell has 4 sets of chromosomes. This is a lethal condition. Mosaicism refers to presence of 2 or more population of cells with different genotype in one individual. Aneuploidy can have a chromosome number either greater or smaller than that of a wild type. For example, monosomy 45X has a chromosome number fewer than 46, and trisomy 47XXX, tetrasomy, and pentasomy all have chromosome number greater than 46. Non-disjunction is the most common cause of aneuploidy. The most important factor that predisposes a patient to non-disjunction is advanced maternal age. Other environmental factors, such as smoking, alcohol, and drugs, may also contribute to non-disjunction. The extra chromosome or missing chromosome could be paternal or maternal. It could be derived from meiosis 1 or meiosis 2. It also could be post-zygotic. Here is the data showing how many pregnancies are lost with aneuploidy. For example, about 80% of pregnancies with Down syndrome are lost. This number is increased with trisomy 13 or 18, and this number is even higher with Turner syndrome. Here is the data showing distribution of numerical chromosome abnormalities among abortuses. Among them, 3 aneuploidies are notable. First is monosomy X, followed by trisomy 21 and trisomy 16. This is the incidence of aneuploidy in a newborn. For example, there are 15 babies born with Down syndrome in 10,000 newborns, compared with 1 to 2 babies born with monosomy 45X. Down syndrome often causes moderate mental retardation. Most of cases arise due to trisomy 21, as shown in people with this karyotype. A small percentage of cases arise due to Robertsonian translocation. This slide shows the risk for Down syndrome at various maternal ages. When the mother is younger than 30-year-old, the risk of having a Down syndrome child is about 1 in 1,000. At 35-year-old, the risk is more than double. The risk gets much higher when the mother gets older. People with Down syndrome may have some or all the following physical characteristics: upslanted eyes, or called oblique palpebral fissure, flat nasal bridge, low-set ears, protruding tongue, epicanthal folds, blush-filled spots, and a single crease of the palm. Down syndrome have several associated conditions. 40% of newborns with Down syndrome have congenital heart disease. Typically, they have atrioventricular septal defects. They have a higher than normal rate of duodenum achisia and hypothyroidism. They have an increased risk for leukemia. The recurrence risk is typically 0.5% to 1%. In familial translocation cases, the risk may be higher. Trisomy 18, also known as Edwards syndrome. Here is a karyotype for trisomy 18, and this is chromosome 18. Babies born with trisomy 18 have mental retardation and severe heart defects. Physical characteristics include prominent occiput, receded jaw, clenched fists with second digit overlapping third, rocker bottom feet, majority die within a year. Trisomy 13, also known as Patau syndrome. Here is a karyotype for trisomy 13, and here is chromosome 13. Babies born with trisomy 13 have a severe mental retardation, severe heart and urogenital defects. Physical characteristics include microcephaly and cleft lip and or cleft palate. Rocker bottom feet, may have polydactyly. Majority die within 6 months. Trisomy 13 and 18 show an association between increasing incidence and advanced maternal age. And in both conditions, the additional chromosome is usually of maternal origin. Y chromosome determines male sex. Monosomy X can survive. Monosomy Y is lethal. Sex chromosome numerical abnormalities are usually less severe phenotypically than autosome abnormalities. Klinefelter syndrome represents a male hypogonadism with two X and single Y chromosomes. Here is a karyotype for Klinefelter syndrome. Here are two X chromosomes and one Y chromosome. People with Klinefelter syndrome are tall. They lack secondary male characteristics. Biochemically, they lack testosterone and elevated level of luteinizing hormone and follicle-stimulating hormone. They have gynecomastia and mental retardation. Turner syndrome represents a female hypogonadism. This is a karyotype for Turner syndrome. There's only one X chromosome. Babies born with Turner syndrome have webbing of neck and congenital heart defects. When they grow up, they have short stature and streaked ovaries. They fail to develop secondary sexual characteristics because they lack estrogen. 50% of them developed hypothyroidism. People with XYY syndrome have normal intelligence and fertility, but they have increased growth rate from early childhood. It is caused by non-disjunction during meiosis II in males. People with trisomy X are taller than average. Occasionally, they have learning difficulties and decreased muscle tone, but they have normal fertility. It is caused by non-disjunction in primordial germ cells for oocytes or sperm cells. Now, let's move to part 3. We will look at structural abnormalities of chromosomes. Structural abnormalities occur when chromosomes are broken by agents called clastogens, such as radiation, virus, and chemicals. Structural abnormalities can be balanced or unbalanced. A balanced alteration does not result in a gain or loss of genetic material. On the other hand, an unbalanced alteration results in a loss or gain of genetic material. Structural abnormalities include translocation, deletion, and inversion. Translocation occurs when chromosomes are broken and the broken elements reattach to other chromosomes. As shown here, two chromosomes are broken and broken elements exchange so that there's no net gain or loss of genetic material. This type of translocation is called reciprocal translocation. On the other hand, these two are acrocentric chromosomes. When they are broken, two long arms are joined while two short arms are lost. This type of translocation is called Lobsonian translocation. Here are chromosome 2 and here are chromosome 8. When one chromosome 2 and one chromosome 8 exchange genetic material, this alteration is reciprocal translocation. The individual who carries reciprocal translocation will not usually be affected because this person has the normal complement of genetic material. However, his or her offspring can inherit unbalanced chromosome material, resulting in partial trisomy or partial monosomy. How will that happen? To answer that question, first we put 4 chromosomes into 4 quadrants. We put 2 wild-type chromosomes into 2 diagonal quadrants and the 2 recombined chromosomes into the other quadrants. For alternate segregation, chromosomes from diagonally opposed quadrants enter gametes. For example, these 2 chromosomes enter one gamete, and the other 2 enter the other gamete. It results in balanced chromosome. When one of these sperms fertilize a normal egg, it results in a normal child and a child who carries reciprocal translocation. For adjacent segregation, chromosomes from adjacent quadrants enter the gametes. For example, these 2 chromosomes enter one gamete and the other 2 chromosomes enter the other gamete. When one of these sperms fertilizes a normal egg, it results in one child with partial trisomy 8 and partial monosomy 2, and the second child with partial trisomy 2 and partial monosomy 8. Our conclusion is a man with reciprocal translocation may have children with partial monosomy for one chromosome and partial trisomy for the other chromosome. As you may recall, when 2 acrocentric chromosomes are broken, for example, chromosome 14 and chromosome 21, when they are broken, their long arms are joined, while their short arms are lost. The result is Robertsonian translocation. What will happen to children of a man with a Robertsonian translocation? To answer that question, we similarly place 2 wild-type chromosomes into 2 diagonal quadrants and 1 recombined chromosome into any one of the leftover quadrants. For alternate segregation, chromosomes from diagonally opposed quadrants enter gametes. It results in balanced chromosome. When one of these sperm fertilizes a normal egg, it results in a normal child and a child who carries Robertsonian translocation. For adjacent segregation, chromosomes from adjacent quadrants enter the gametes. For example, these 2 chromosomes enter one gamete and this chromosome enter the other one. Alternatively, these 2 chromosomes enter one gamete and this chromosome enter the other gamete. When one of these sperms fertilizes a normal egg, it results in 4 different embryos. First embryo with trisomy 21, second embryo with monosomy 21, third embryo with trisomy 14, and fourth embryo with monosomy 14. All these three genotypes are lethal, leading to pregnancy loss. Only embryo with trisomy 21 may survive to term. Here is a karyotype from a Down syndrome patient. One chromosome 14 is longer than the other one. It is a fusion of chromosome 14 and chromosome 21 following Robertsonian translocation. As shown in this picture, chromosome 14 are labeled in yellow and chromosome 21 are labeled in blue. As you can see, there are 3 chromosome 21. Here are diseases caused by chromosome deletion. For this class, we will focus on Cri-du-Chat syndrome, caused by deletion in chromosome 5, Prader-Willi and Angelman syndromes, caused by deletion in chromosome 15, and DiGeorge syndrome by chromosome 22. A deletion occurs when a chromosome is broken and the material is lost. A terminal deletion is a single break in which the lost material includes telomere. An interstitial deletion occurs when there are 2 breaks on a chromosome and the material between the breaks is lost, as shown in this picture. Cri-du-Chat syndrome is a result of terminal deletion of short arm of chromosome 5, as shown in this picture. Babies with Cri-du-Chat syndrome have kitten-like cry. Children with Cri-du-Chat syndrome have mental retardation, microcephaly, wide-set eyes. They also have cardiac defects, especially ventricular septal defects. DiGeorge syndrome is caused by deletion of long arm of chromosome 22. Children with DiGeorge syndrome have cardiac defects, abnormal faces, thymic hyperplasia, cleft lip, and hypocalcemia. Put together, DiGeorge syndrome can be summarized in one mnemonic, catch 22. Here, 22 refers to the fact that deletion occurs on chromosome 22. An inversion occurs when the chromosome segment between 2 breaks is reinserted in the same location but in reverse order. For example, there's a break at B and there's a break at C. When this segment is reinserted in the same location but in reverse order, and this is inversion. Inversions that include centromere are pericentric. Inversions that do not include centromere, for example, like these, are paracentric. Inversion carriers still retain all genetic material, so they are usually unaffected. Because homologous chromosomes must line up during meiosis. For example, homologous chromosomes line up during meiosis. Inverted chromosome will form loops that may result in gamete that contains a deletion or duplication, as shown in this picture. And this deletion or duplication may be transmitted to the offspring. For other structural abnormalities, I'm going to show you ring chromosome and isochromosome. Typically, a ring chromosome forms when deletion occurs on both tips of a chromosome and the remaining chromosome ends fuse together like this. Ring chromosomes are often lost and result in a monosomy. For example, loss of ring X result in Turner syndrome. Here are two sister chromatids. Normally, they are separated with one short arm and one long arm staying together. When two long arms or two short arms staying together during cell division, it will create isochromosome. In this case, two long arms stay together. Because of lethality, most isochromosomes found in live births involve the X chromosome. Here is a karyotype of isochromosome for the long arm of X. As shown here. This karyotype results in an individual with Turner syndrome. This person has 3 long arms and 1 short arm of X chromosome, but the person still has Turner syndrome, indicating loss of 1 short arm is responsible for the phenotype seen in Turner syndrome in this person.
Now, let's move to part 4. We will look at Y chromosome and sex development.
In human beings, the sex status is defined at 4 levels: chromosome, internal organ, external organs, and psyche. The differentiation of the fetus as a male takes place during the 6th or 7th week of gestation. The development is directed by the SRY gene. Throughout the 9th to 13th week, development of a male genitalia depends on the conversion of testosterone to DHT by 5-alpha reductase within the target tissues of genitalia, as I have shown you before. This picture on the left side shows you genes important for male development. Besides SRY, 5-alpha reductase and androgen receptor have been covered before. Today, we add SOX9 gene, which is located on chromosome 17. On the right side are genes important for female development, particularly DEX1 genes. DEX1 is on the short arm of X chromosome. The product of DEX1 gene inhibits genes that leads to male differentiation. That explains why loss of only one P-arm of X chromosome is sufficient to cause Turner syndrome. The SRY gene is located on the P-arm of Y chromosome, in the region that can exchange genetic material with X chromosome. This is why this region on the Y chromosome is called pseudo-autosomal region. There are 2 pseudo-autosomal regions on Y chromosome. Swyer syndrome, or XY gonadal dysgenesis, is typically caused by loss of SRY gene. People with this condition have hypogonadism. They have low level of androgen and estrogen, an elevated level of luteinizing hormone and follicle-stimulating hormone. This person is externally female, as shown here. They have strict ovaries. If left untreated, will not experience puberty.